Bonjour à toutes et à tous. Bienvenue à ce point de presse.
Welcome, everyone, and welcome to this press conference from the Premier of Quebec, François Legault, the Minister of Health and Social Services, Monsieur Christian Dubé, and the National Director of Public Health of Quebec, Dr. Horacio Arruda. Mr. Premier? Yes, hello, everyone. Well, first, I wish to say that I'm so happy yesterday to saw the businesses open. I know that it's been hard for business owners, very often small entrepreneurs who have had a very hard time in the past year. So I think that Quebecers were also happy to be able to go back to those stores. I was also very happy to see, and this is something that we'll be seeing gradually, students go back to CEGEPs and universities. So to be able to see their classmates and their professors, it has to be understood that it's been really hard for students as well. There are some who had not gone to CEGEP or university in 11 months. It's not normal when you're 20 years old to be at home for 11 months. So I think that it is important, and it gives a little bit of breathing room as well. When we look at the situation, it continues improving, so we can see whether it be the number of cases or the number of hospitalizations or the death toll, when we look at the averages, they're going down every day and have been doing so for a few weeks. So that is encouraging, and that means that our measures are working. It also means that our measures are working, amongst others, when we look at the hospitalizations and death rate. Our measures are working in the people 65 and over, because as I'm repeating, 80% of people who are hospitalized are 65 and over, and 95% of people who die are 65 and over. So when we see the number of hospitalizations and death rate decrease, that means that there are fewer contacts with those people 65 years and over. There's a certain number who are in businesses, but there are many others who are in homes as well. So we might think, although there's no direct evidence, that the curfew is giving good results. So we are happy to be able to see that trend right now, which is a positive one. However, there is a but. We have to continue being prudent. So we have to continue being prudent, and I saw, for example, here in Quebec or in certain regions, people are looking forward to going to the orange zone, and we're keeping a close eye on that. We'll get back to you on that next week, but it remains that we must be very prudent, particularly because of the situation in hospitals. And I understand quite well that it is difficult, and there are people who really are looking forward to seeing their friends again, of having parties, of having dinners amongst friends. Over the weekend, it was my best friend's birthday, so we were a group on Zoom, and it's not the same thing to have a drink on Zoom. That's quite clear. So I very much understand that people are looking forward to this, but it remains that this pandemic is there, and it's here. We just reached 10,000 deaths. It's quite a catastrophe when we think of it, 10,000 people who have died. And I wish to once again offer my condolences to all the families of the victims, and to reiterate as well that the 11th of March we are going to have a large commemoration for the sad anniversary of this terrible crisis. And I can see that people are trying to compare things here and others. We have to be careful. I can see that we've started having numbers on the over-mortality, and we can see, and it requires explanation. In Quebec, we have more deaths than over-mortality. Many places where it's the opposite. What we can see, of course, is that it's been very hard in Quebec. It was very hard on the first wave. We are doing better on this second wave. When we look at the total for the 11 months, keeping all proportions, when we look at the G7 countries, we don't compare as well to the rest of Canada and Germany, but we are doing better than the United States, France, Spain, Italy, and the United Kingdom. So we can still see that when we look at the G7 countries, we're not the best, but we are amongst the ones getting through it the better. But of course, for the first wave, particularly what happened in CHSLDs, we have to all draw collective lessons from what we lived in the past year. But in the short term, the battle is not yet over. So before just going over into numbers and comparisons, we have to continue with the battle. Today, we still have 940 patients who are hospitalized because of COVID-19. Today, we have an average postponement of 27%. Last week, we were at 34%. So that means that the situation is improving. But on the other hand, it also means that we are still postponing 27% on average of our surgeries. And it means that not only are we not reducing the waiting list, we are still increasing it. So we all have to keep this in mind. And we have to also think about our nurses and the entire healthcare staff working in our hospitals. It's been 11 months. Please remember that even before the pandemic, we were missing nursing staff. So imagine when we add all of these COVID patients, although we did have an agreement on the normative clauses with the FIC, that is the union that represents many of the nursing staff, in order to try to improve their working conditions, it remains that I hear the nurses and I understand them, that it is really hard. And at the same time, I'm open to all comments and suggestions. Same thing for the Minister of Health. But we can't do a magic trick. We can't quickly just invent nurses. And we're trying to accelerate training, but we continue having a shortage of a lot of nursing staff. And that is reason sufficient for me to ask all Quebecers to continue being extremely prudent. Yes, we can go and shop and take a walk, of course, go to school, go to work. But otherwise, please stay at home. Stay at home. I know that it's not always all that fun staying at home, but I want to take advantage of this to congratulate Télé-Québec. On Saturday evening, we had a theater piece, La Face Cachée de la Lune, so with the great Robert Lepage and Yves Jacques as well, who is an excellent actor. And I looked at that with my wife and my two sons. Some people didn't like the ads so much, but it gave me the opportunity to be able to chat about the text with my boys and my wife. But I want to say bravo. Bravo to Télé-Québec, and we're going to try to work with the Minister of Culture to have more of these kinds of opportunities, particularly in the context that we are experiencing right now. To end with, there's another request that I'd like to make, and the Minister for Health has put an emphasis on that, as well as the National Director of Public Health. People have to go get tested more quickly. Right now, we're calculating, because we're asking, we ask the questions. People on average wait over 2 days before they go get tested, 2 days after having started getting symptoms. It's much too late. As soon as you get symptoms, you should go get tested. We've added a lot of testing capacity. It doesn't take long, and it doesn't take long either to get the results. Perhaps a word as well to say that we are not forgetting about the spring break. We're going to get back to you over the next few days. The spring break is the week of the 1st of March, and we do have a concern with the spring break. Usually, there's a kind of, a lot of people moving around during the spring break, even if people remain in Quebec. I wish to repeat to parents, this is not the time to organize activities with other families. It is also not the time to ask those who are 65 and over to babysit the children. It concerns us, and we're going to get back to you, and we're not excluding right now for that week of the 1st of March of adding additional measures in order to avoid that what happened over the holiday period take place during the spring break. So to conclude with, we're going along the right way, but we still have to keep very with a great deal of prudency, and we have to think about our healthcare staff who've been working really hard for the past 11 months and who are short on staff.
I was very happy to see stores reopen yesterday. It has been a difficult year for them despite government help. We also saw CEGEP and university students return to campus. I'm happy to see that they're restarting to return to a more normal life. The situation continues to improve. The measures are paying off, especially for people over 65, but we have to stay very careful. I know that many Quebecers are tired of the measures. I know a lot of people can't wait to see their friends, but we have no choice. We must continue to make sacrifices. We've now passed the 10,000 deaths cap. I want to offer my sympathies to the families of those we've lost. The situation is still very difficult for our nurses and workers in hospitals. That is why I ask Quebecers to remain extremely vigilant. We can go for a walk, go to school, go to work, go to the stores, but other than that, please stay home. I also ask you to get tested if you have symptoms. We've also concerned about the March break. We cannot gather with other families, and people over 65 cannot babysit children. We don't rule out imposing new measures during this week. So we're going in the right direction, but we have to stay careful. This is the best way to help our nurses and all our health workers. Thank you.
Merci. Nous allons amorcer la période.
Thank you. We will now start with the question period.
Le laboratoire de santé publique
The Public Health Lab just told us that there are cases of the South African variant, 2 cases that have been identified in the Abitibi-Témiscamingue. This morning, the opposition party said that we should be testing all positive samples for variants. Other provinces do so. Are these 2 new cases with a new variant on the Quebec territory up until now, does it not show the necessity of doing so? We've been following the variants since April 2020. We had given ourselves the capacity to detect variants. And I wish to tell you that right now we have increased in Quebec the capacity to 8% of the samples. As we will be reaching 10, we believe, and then 15. So right now we're at 8%. If we compare ourselves to other provinces who are at about, from what I'm told, 3% or so, the United States are at 1%. There's only Darmac that's at 18%, but we are going to be, with 15%, the possibility of detecting the phenomenon, especially because we apply criteria with people who come back from traveling abroad, so criteria and transmissibility. And as soon as there are outbreaks, if we feel that there's a lot of transmissions, we'll be able to do the other testing, the cribbling test, it's a kind of screening test, which, before getting to the sequencing test, will allow us to identify mutations in the virus. For example, 3 mutations that are linked to the strains in Brazil, South Africa, and the UK. Right now, following sequencing that was done, and I would say even following cribbling, we have identified a South African strain that appeared within a context of 2 outbreaks that were well controlled because they had had a greater transmission associated to a restaurant, a fast food restaurant, and another outbreak following a party. So we had sent that for sequencing, and that is where we realized that there was that South African variant. So right now, in Quebec, if I summarize, is going to give itself a very adequate capacity to be able to sequence and do the cribbling screening within 1 to 2 weeks. Many regional labs are also going to be able to do this cribbling for the strains that we're talking about right now, which are the most frequent. Mr. Premier, we know you're very concerned with accountability. Concerning the Manoir Liverpool, the CIS realizes that there's been many complaints about this establishment in the past, but their CEO, Mr. Paré, in the media the past few days said that he was not aware of those complaints, whereas the CIS confirms the existence of those complaints. So Are the explanations of the CEO convincing for you, and can he remain in his position, taking into account the information? Well, yes, it does concern me, so I ask a question to the Minister of Health. Well, first, on the report itself, I had the opportunity of speaking with the investigator yesterday, Ms. Ouellette, and I wish to share with the public, all those who had family in those circumstances, that the situation that we were made aware of with her report is totally unacceptable. I would like to talk about two different points about this. First, after having had a good discussion with Ms. Ouellette, the first question that I ask myself and that I don't find an answer to is to know how the owners were able to so many things to hide the situation as they did for 5 years. And I'm choosing this word, they did a kind of double crossing. Does it justify the very hard actions that we could take against the owners who knowingly hid things from the public, not only to the family, but also the management? Because we are here in a case, and I don't want to go too much in the details, but we are in a case of an RIRPA. So the CIUS have rights towards certain RIs, less so towards the RPA. So we're stuck here in a situation where the owners have often played with the rules, and that they were able to hide that situation for 5 years. I want to push that a great deal more further to understand, and what are the measures that we can take in order to make these owners accountable. And I continue along the same way. Yesterday, we started other investigations that are going to be done on the same owners who have a CHSLD, a private one, that has a convention plus an RPA. So on the first part of what will follow this investigation, because I said that I was going to push that analysis much further. So I will question what we will be doing with those owners, and it's going to go further than that. The second question that I am asking myself, and I had the opportunity of speaking with Daniel Paris to make sure that what had been declared and what I had heard, and I had long discussions with him yesterday to make sure that he confirmed to me that he did not receive that information himself, and that there had been cases of mistreatment. And I wish to remind people, because I've told you that I'm going to go further on that end as well, Mr. Paris, in the past few years, while he was CEO of Chaudière-Appalaches, had cases of mistreatment, and every time he closed down or changed the owners of those establishments, he did it in 13 cases. So what he explained to me clearly is, he said, why would I have done it in 13 cases but not in this case of the Manoir Liverpool, if I had been informed? So I take that statement, which I respect, and what I ask, and that is why I'm announcing today, I talked about it with Ms. Savoie this morning, that the investigation that had been made, very well made by Madame Ouellette, is an investigation that was ordered by the CIS. So it is what we would call an internal investigation, and that had as an objective to see what was happening in terms of mistreatments. But the second question that I asked myself was, how can it be that such an information, where sometimes I'm told, sometimes it's mistreatment, sometimes it's negligence. I don't want to play on words. Sometimes it's administrative problems. I mean, I'm not going to play with those words. But how can it be that such serious cases did not go all the way up to upper management in the CIS? Who acted on the command chain so for the information not to get there? Is it that some people stopped the information? And I have not received answers to my questions in the past few days yet. But with that information, I've asked Ms. Savoie the Deputy Minister to launch an external investigation, as we do sometimes, in order to go get and shed all the light on what happened and why that information did not make it to the upper management of the CIS. So I'm going to say, and I'm going to repeat what I said over the past few days. For me, Ms. Ouellette's report is not the end. It is the beginning of the investigation. There is, I would say, I'm sorry, it's a really long answer, but to end with, I would say that there was a culture in our CIS and our CIUS of supporting management of our establishments, and I think we have to change the culture. The culture has to be of supporting the patients, of supporting the complaints. My colleague, Minister Blais, launched a bill that passed last fall on mistreatment. Right now we have a commissioner to mistreatment, and that commissioner is now going to support the commissioners who are in the CIS who are supposed to receive the complaints. And we're going to go further. If we have to update the Act on abuse and mistreatment, it will be done so. And for me, this case is going to be a change of attitude, and we're going to continue pushing the analysis of what happened in Chaudière-Appalaches and put an end to the shenanigans.
Désolé.
Bonjour, Monsieur le Premier ministre, Monsieur le ministre, Dr. Arruda. Monsieur Legault,
Mr. Legault, the opposition continues asking for a public investigation on the management that you made of the pandemic. We've reached 10,000, actually we're over 10,000 deaths. The 3rd of April 2020, you have said, and I quote you, our success or our failure will depend on the number of deaths. So after 10,000 deaths, what can you say about your management? Is it a success or is it a failure? I think it's too early to have detailed summaries. But as I was saying earlier on, we have to separate the first and second waves. I think that in the second wave, Quebec has done much better. In the first wave, not as well as the rest of Canada and Germany, but in total, in the past 11 months, better than the five other countries of the G7. What happened with our CHSLDs, where we know that we had a shortage of staff, there were no bosses in certain CHSLDs, and consequently, there are employees who did not wear all the protective equipment that they should have worn. So Joanne Castonguay is already making a full investigation with all the powers equivalent to an independent investigation. The big advantage is that we're going to get the results by September. So let's recall, the Commission Charbonneau took 4 years. I don't think that we want to get into something that's going to last years because we want to change what has to be changed as quickly as possible. I'm already thinking that we've brought a lot of changes over the summer. When we compare ourselves with the second wave, we can see that we're faring better than the other G7 countries. And I think that everything is in the works to be able to get to the bottom of it. You talked about the 2 cases of new variants, the South African variants that were detected. First, would it be possible to have the details? You gave a few details, but to be more specific on the details about those cases of contamination? And does it make you fear? Because up until now, we had 8 cases of the British variant, and now we realize that we have on top cases of South African variants. What is your level of fear with these new variants that are starting? Well, what's clear is that the new variants, if they are associated to a greater transmissibility, but particularly a higher mortality or morbidity, that is of concern, because if we let them just spread, we are going to be going back to a very important pressure on the healthcare system, etc. However, the measures that we are applying right now for the control of the other strains are the same for the new variants. So what we're going to be doing, however, in targeting or in cribbling a little bit more, we can identify them more quickly and perhaps be more rigorous in our follow-up about the cases and contacts. I believe that the answer to this remains the application of measures. That's why it's so important that we apply them in this context, in the context of a new variant. Nobody's happy to have new variants. No country is happy to have new variants. But thankfully, we have shown in the literature that if we apply the measures that we're applying right now, the distancing, the sharing of the mask, respecting the measures, that we can get to control those new variants. Last week, I was speaking with Jason Kenney, who was telling me that in Alberta, up until last week, there were up to now 56 variants. And Alberta is about half the population of Quebec, so everything is relative. We have been, pretty lucky so far.
Bonjour à vous trois. Monsieur Dubé,
Mr. Dubé, on the 25th of January last, the INSPQ recommended using N95 masks. There are 30,000 workers who were infected. You still haven't given the authorization of wearing the N95 everywhere in red zones. Why are you not doing so? Is it that we don't have enough masks? No, not at all. Listen, Mr. Laforêt, this is a file, on the contrary, that has gone forward quite well in the past few days. We have to remember the events of the past few weeks. There's been an update on the part of public health on the question of aerosols. With that update that we received on the part of public health, there were requests and discussions that started, particularly with the CNE-SST, in order to be able to see under what conditions we might apply what was now acceptable by public health. My ministry, Ms. Savoy, with the people from Human Resources, concluded an agreement that was acceptable for the request made by the CNEST, because the CNEST arrives with a notice, and that agreement was concluded last Friday. Only the details remain, but I think that the guideline that is going to be brought forward by the ministry is going to close this entire discussion. So I'm very happy that we've managed to find an agreement for everyone. For the workers, we had to define what an uncontrolled outbreak was. So we went towards the hot zones. We found a good way of finding a balance between what the CNES was asking for and what public health was asking for. So I would say that we have a solution now. It's just we are finalizing the guidelines right now, so it's a question of a day or two. Mr. Premier, the Minister of Public Safety and Deputy Minister asked for Judge Louis Dion to investigate on the camera business. What is it exactly that you are expecting, and what delay of time are you hoping to have answers? The interpreter missed a part of the question. Well, first, the reputation of Judge Dion is quite high. Judge at a superior court who was Deputy Minister at Public Safety, Deputy Minister at Justice, who was responsible for the DPCP. I don't think that we can imagine somebody who knows the system better than he does. So, of course, we want it to be done as quickly as possible, but we also want him to give him the time to be able to get to the bottom of things. So we want to know what happened, because it is concerning. And listen, it makes no sense, and Quebecers don't like that either, to see what they've been hearing in the past week. So we have to get to the bottom of this, and I believe that we have the best person to do so in the person of Judge Dion. Mr. Dubé, on masks N95, if I understand your explanations, it is therefore not a recommendation from public health to extend the wearing of the masks to the hot zones. It's the CNE-SST that made that decision of going forward with it. So why is it the CNE-SST that is making the decision and not public health? Well, the CNE-SST also has its own analysis organization and its own network of experts. And in this case, what was asked for by public health was to go and bring N95 masks, what we used to in what we call in situations of uncontrolled outbreaks. And trying to define what an uncontrolled outbreak is, that is what required a few days in order to be able to agree with the CNESST, which was saying on the one hand, what we want is to protect our workers while trying to have a definition that is as simple as possible. So we agreed after long discussions that the best way to be able to bring both parties together, that is public health and CNSST, was to take our definition of what a hot zone is. And a hot zone is where we have 2 outbreaks and more, 2 cases and more. Therefore, an outbreak. So that's exactly what I just said. And I'm happy because we had to find a way to get that to be readily transferable to the field. And the good news is that on top of the N95 masks now, we have them because that we've signed agreements. We now have a Quebec manufacturer. So I'm happy because all of this happened at the right moment and we can have a solution that everyone agrees with. The unions, the Ministry of Health, and the CNS. So I think that we have a very good decision. I'd like to hear you on the vaccination. There's been many delays in the past few weeks. The calendar has not been republished with any update. I'd like to know precisely, is it still realistic, according to the predictions for the following weeks, on the supply and procurement, to start the vaccination of the 80 years and over in mid-February? Is it still realistic? And also, is the objective still to have finished the vaccination in RPAs and the healthcare staff by the first week of March? Is that where are we still there, or is it no longer possible? Well, I'm going to be prudent, very prudent even, because I had a meeting yesterday with the different health ministries as well as the federal government to get it reconfirmed, and I re-asked Major Martin whether the quantities that were promised us are going to be there in the following weeks. And according to him, there were no changes. So that's the good news. So based on that data that was confirmed yesterday, we should be able to respect most of our commitments. Of course, and I'm going to end on that, of course, the more we're squeezed toward the end, the more difficult it's going to be to achieve. But as of now, we should be able to give all of our doses if we get the deliveries as the major confirmed to us yesterday. Mr. Dubé, we heard Mr. Trudeau. Do you guarantee that all Quebecers who want to be vaccinated will be so by September? Well, under reserve of having the vaccines, yes. Do you believe we're going to have them? Well, listen, I felt, and we're positive because I think that we put a lot of pressure on the federal government, but I felt this week that there was a level of trust on the part of Major Fortin that he would be able to deliver on those commitments. But up until now, we've had so many surprises that I do want to remain very, very prudent. I spoke with Justin Trudeau on Thursday evening, and he assured me that we would have the doses that were promised for the 31st of March, and that everybody who wishes to be vaccinated would get the doses by September. Psychological distress of healthcare workers. There's been suicides among workers. What are the means that are being taken right now to help those people? I would say that we're talking about it a lot, and the things to be done have to be concrete. I've had meetings, I often mention, inter-union meetings. I speak very often with Ms. Bédard from the FIC, the union, who talks to us about different cases of distress. And I think we have a lowering of the number of staff that was contaminating, which is better. We're now at fewer than 6,000, so 5,700 to be exact. We have additional staff coming from the student body. We are working with our CEOs following a discussion that we had with Ms. Bédard yesterday on how to minimize the impact of the Reality 007. There are many measures that we're putting together to decrease the pressure on our nursing staff and people in the health network in general. But I would say that the very best measure is the one that Quebecers have adopted in the past month. That is to lower the number of hospitalizations and to give a break to our people from the health network. It's the best thing that can happen to everybody. You said so earlier on, you're very scared of the spring break week. Is it therefore completely excluded to have certain regions go into a different zone, like the capital region, because of the spring break, so to bring them into orange zone before the spring break? It's not excluded, but as I was saying earlier on, there might be additional measures only for that 1 week of the 1st of March. It could even be in present orange zones. What we want to see, and I was talking about it this morning with public health, is we don't have any concerns. For example, in interregional transfers, we don't see right now the necessity of having roadblocks. But will they become necessary for the week of the 1st of March? Perhaps. What will we do for the curfew for the first week of March to avoid there being contacts during the spring break? These are things that we are talking about. We'll get back to you on that in the next few days. This morning, we discovered that there's an important failure rate in students in secondary 3 or 4 and 5. Of course, when the government decided to set up, the 1 day out of 2 for secondary 4 or 5, we excluded the half class. We decided to do it 1 day out of 2 for secondary 3, 4, and 5. The reason why you'd done it at the time was to have fewer people in cafeterias, for example. But is there really an epidemiological reason to continue doing that 1 day out of 2, particularly when we see the results? Even the Federation of the Teaching Establishments judges that a correlation between the failure rate and the fact that the secondary 3, 4, and 5 students are at school only 1 day out of 2. Well, first, I'm very proud to say that Quebec has kept, in the past 10 months, its children at school a great deal more than, for example, Ontario or other jurisdictions. You'll remember that Quebec in the spring was about one of the only places that reopened its schools. Why do we have 1 week out of 2 in high school? Because we think that it is more efficient, that remote teaching is more efficient for high schools than it is for primary schools. But although we are one of the places in the world where we've had children in school the most often, we still have to note that there is no impact on, success in school for having lost those days of having to learn, remotely. It's not ideal, and we know it. So I've asked Jean-François Roberge to put everything that it is possible to set up for catching up, tutoring, etc., to make sure that we give the very maximum to our children so that as many as possible can succeed with their school year. I'd like to get back to the question of the spring break and the measures that might be added. You talked about the possibility of roadblocks and maintaining the curfew. Are there any other measures that you are thinking about, possibly? Well, first, we want to see where we'll be at concerning the orange and red zones. By next week, we should be able to say, well, this is what we are proposing for the 22nd of February. So we'll see first where we'll be globally in all 17 regions of Quebec before the 1st of March. We'll also see where we're at in the number of cases and hospitalizations, et cetera, et cetera. So we'll have discussions with public health and get back to you. But already we are looking at different scenarios in order to set up additional measures for the week of the 1st of March, because traditionally during spring break, there's a lot of people getting together. We were talking about the situations of RPAs earlier on. They're also facing staff shortage, staff that is very expensive. Right now you're giving them premium, but once they're over, they're saying that they're going to have to increase. They're going to have an increase in fees, so they want to have a higher tax credit to keep people at home. Is this something that is being talked about at the government, to increase the tax credit to maintain people at home, to allow for them to be more accessible? Well, look, we are in a budget period right now. The Minister of Finance is having consultations, which you know about pre-budget consultations, and I have had requests that are very clear that came from the different RPA owners of those residences. Of course, it is in our government philosophy to keep people at home as long as possible. So home care includes residences for the elderly, RPAs, but it's a little too early right now to be able to tell you what these discussions lead to. But I would like to remind you that our government in the past few years has massively increased the sums that are invested in home care. We had committed ourselves to putting 200 million per year, an extra amount, for a total of 800 million over 4 years. We're now at 1.4 billion. So we've increased the support to home care, and we're going to have discussions on what we do for RPAs with the Minister of Finance over the next few weeks. Dr. Arruda, I'd like to get back to the screening that you call crippling technology. In the case of COVID-19, it's already used in Ontario, where we see that there's a lot of cases of variants that were reported. Here it's 11 compared to that. Does that mean that there might be a much higher number than we believe of circulating variants right now? Well, it's a case everywhere. You'll understand that cribbling and sequencing is always done on a sample, not on 100%. So it's often associated to an increase of transmission. So I think that Quebec had a 3% sequencing that was done, and I believe that with the arrival of these new variants all over, it's probable. And I wish to tell you that right now there are, in fact, what we gave you as the numbers. We are at 11, what was published by the Institute, but there are many tests that are going to be sent to sequencing that are, and on the basis of crippling, we already have some situations where we believe that it might be a UK variant, etc. So we're intervening anyway, using that as information. But if you're asking me the question, yes, it's true that there's always more cases than what we can predict. The present numbers in Quebec are relatively low. Although we've decreased screening, the positivity rate is low at 3.4%. So there probably are cases, but I would say, like the 2 cases in the Abitibi, the 2 cases of South Africa, did not continue transmitting in the Abitibi region, but we had to keep a very close eye on it. We have to remain vigilant. Mr. Legault, I'd like to quickly go back to my colleague's question on the investigation requested by the opposition on COVID-19. This morning, Ms. Anglade from the Liberal Party was saying that she considered that the mandate of Ms. Castonguay is too restrained, in the sense that it is only studying CHSLDs and care for the elderly. Would it be appropriate to extend the mandate, Ms. Castonguay's mandate? Well, first, we would have to see whether when we compare the results of hospitalization and deaths, if we exclude CHSLDs, is there a situation that would warrant an investigation outside of CHSLDs? Not sure. Otherwise, it's the first time that Dominique Anglade arrives with what different mandate she'd like to give to Ms. Castonguay. Because is it because of the mandate? Is it because Ms. Anglade does not trust Ms. Castonguay? She would have to tell us exactly why she doesn't like the investigation being conducted by Ms. Castonguay. Mr. Premier, how do you react to the preliminary statistics on the report cards during the pandemic that are not very good, and to ensure the highest possible success rate? Some people are talking about the possibility of organizing learning camps. Do you agree with that proposal? Well, first I want to repeat what I said early on. That is to say, I'm very proud that it is in Quebec that we have kept the greatest number of days of presence of our children in school. Second, it's obvious that everywhere in the world there will be delays for those children who didn't go to school or who had remote learning. Now, Jean-François Roberge has already announced tutoring measures Will we have to add measures such as catching up camps, day camps? Well, at this moment, we're not excluding anything. I've asked Jean-François Roberge to do the very max so that children succeed their year. Dr. Arruda or Mr. Dubé, many people are noting that it's particularly those people who have precarious jobs, who often don't have any insurance at work, who do not get screened, sometimes because they fear ending up without wages. What can be done to entice those people to get screened more? Should we ensure, go back up a little bit to the safety net so that they don't feel powerless if they get a positive diagnosis and have to isolate themselves for many days? Well, I'd like to start maybe because we talked about it last week, and I really appreciate the question because very quickly, when we have a positivity rate, as Dr. Arruda was saying today, even at 20,000 tests, at 3.8%, that's a very good rate of positivity because usually when we have a test, you could have a much higher rate. So that is the good news. But we would like to have 3.8 out of 40,000 and not out of 20,000. That would reassure us even more. So to answer your question, that is why every time we are here, we ask people to not be scared to get screened. Now, if there are people who believed that because we were going to call them and that they gave us the fact that they had contacted somebody, that there was a situation where they perhaps did not respect the measures, never are we going to give you tickets or consequences for that. And we've asked people from public health to make sure, and I spoke about it directly with Dr. Arruda and his team, we have to offer to tell those people, you know, do you need for somebody to go see you, to go bring you food, or the services that we can give you? So we are going to accompany these people in a positive way, not a negative way. So I want to reassure people, if you are hesitating, and to reassure what the Premier was saying, you know, to bring back the 5-day delay to 4 days to 3 days, well, we are going to do everything with the entire public, and especially those who hesitated in getting screened. Nobody is going to get a ticket for that. Thank you. We'll now go to questions in English.
Good afternoon. I wanted to hear your reaction to the decision by Health Canada to relabel the Pfizer vials from 5 doses to 6 doses, and whether or not Quebec has enough syringes. So is this possible?
In fact, we already had used 6 doses because there was an extra, I would say, vaccine, and using the right needle, we were able to have a dose. You know, as doses are something we need, we would not have wanted to be wasting. And actually, we are working to get the exact perfect needle to be able to use it. And there is work done also with the federal government to get access to those small needles. We're going to make it more simple. But even with the other ones, we have not lost those precious things because what we need is vaccine.
Did you want to add something? No. Okay. My next question is about the N95 masks. Was it a mistake not to make it mandatory a long time ago to wear these masks? Do you regret not making that decision?
In fact, we always recommended what our Institut National of Public Health has reported, and also other authorities around the world. As soon as the Institute change its advice recently in January, I take off my ordonnance on the 8th of February, on the week after, to make sure that we could respect the new recommendations, because science has evolved. There is not only aerosols, which is the transmission, there is a possibility of it. I think that in most situations, the medical mask is the right thing, but in some conditions, N95 could be added. And you know, using N95 all day is not without any inconvenience. So, but we are following the recommendations of our experts.
Katsuni, CBC.
Following on the, good afternoon. Following on the N95 masks, I was wondering, since it's mandatory for all healthcare workers in hot zones, do you have enough N95 masks that are fabricated, made here in Quebec? So we are not using made in China N95 masks. Is Medicom in Montreal sufficient?
The answer is yes.
So it's going to be N95 mask made in Quebec.
And will be N95, and we have also other suppliers, as you know, that are Quebec made. I'm thinking about 2 of them that have been listed very recently. So we have plenty of masks to be able to, can I say, submit that to our employees when they need them.
On variants, you said that it's scary, the impact that variants might have on the healthcare system and the pressure it may add. Are you thinking about even cranking up the strategy of sequencing and screening tests? If you look at France, Ontario, they are more aggressive on this front. Would you consider basically all positive COVID-19 cases should be screened in Quebec? So you have a better picture of the spread of variants here.
I would say that depends. I don't think that any province is doing it for long term. Sometimes it could be, I would say, an échantillon, a sample during a certain time. We think that with our augmentation of capacity of sequencing till 15% in the next weeks, and the criblage, which is going to be done actually on any cases that will be suspected possibly as this, we will be able to be informed and well apply the recommendations. What I want to say also is that even if we are not happy of having those variants, as anybody is happy in the world, the same measures are the ones that work against it. So I think it's important to remember people that the best way for not having, even if it appears here in Quebec, for not transmitting it a lot, is to respect, I would say, the public health measures of distanciation, mask, and hygiene, and also respect that at workplace and everywhere.
Philippe Autier, de Gazette.
Good day. Just to go back on the variance issue, with the numbers that you've given us today, Montreal is now up to 8. In Toronto, the public health director there has said it's too soon to reopen because of the mystery of the variants, that it's still... So is it still safe to open hair salons and stores and everything in Montreal given this situation?
I think that based on the epidemiology we are observing, actually, even in Montreal, and I could say that outbreaks in commercial sites and have get down. I think the best answer to that is to look at the epidemiology and adjust to that in relation. So, because it's not because we're going to find it necessarily that we're going to have big outbreaks. It's why we must be very careful on identify it. But I think it's a risk management that it seems to be acceptable. But at the same time, we have been cautious. Some would say we have been opening too much. Others are saying we are not opening enough. So that's a balance, actually, of equilibrium. And we'll follow up that every day and every week.
And I will be very brief. I see the clock too. The opposition parties again this morning called upon you, Premier. Madame Anglade said you had a moral duty to have an independent, vast investigation of the pandemic. Do you plan to expand Madame Castonguay's mandate at all?
Well, we already have an independent commission, and Mrs. Castonguay has been chosen by all parties. So I think she started her job already, and we plan to receive a final report by next September. So I think it's efficient, and she's got all the possibility of extending whatever she wants.
Maya Johnson, CTV.
Good afternoon. I know you need to head to the Blue Room shortly. I'll try to keep this quick. First question. We learned just before this press conference that the Public Security Minister is launching an investigation into the camera case. So what kind of a message do you hope that sends to Quebecers that your government is launching an investigation into what happened?
Well, I think it's very important to know exactly what happened, if rules were followed, if we have to change some rules. And I think that Judge Dion has all the experience and authority to make sure we have all answers to our question, because we all have answers about what happened. It doesn't look good.
This weekend, Richard Janda, an associate professor in the law faculty at McGill University, published an opinion piece in La Presse, and I'm going to quote it directly in French because I don't want to paraphrase. He said, "Nous sommes devant un autre."
We are faced with another case that shows systemic racism of the Montreal police forces. I'm using my words. I'm not accusing such and such a police officer of investigation. I'm accusing the functioning and the administration of the SPVM.
And to others who say that what happened to Mr. Camara is a clear example of systemic racism.
I think we don't have enough information to know if it's a case of racism. I think that Mr. Dion will be able to answer this question about the motivation, about why it happened this way. Would it have been the same if it was a white person? So we need to have these answers, and I can understand that people want to have these answers.
Question that's on the table now, even though previously you've refused to acknowledge the existence of systemic racism.
No, I'm talking about racism. I'm not talking about systemic racism. I'm talking about racism.
On doit mettre fin au point de presse. Merci.
We have to end the press conference now. Thank you.